supplementary lessons in this COVID-19 quick birth skills course that our New Zealand NGO Common Knowledge is putting out. Now, why have I saved this for last? Because the childbirth conversation has been pretty crazy since really I gave birth in 1970. In the United States, the first childbirth classes were skills-based. They were Lamaze and Bradley. And there was a very high societal expectation that all expectant parents take a childbirth preparation class. We didn't have choices, so we learned skills. However, those three obstetricians were focused on low-risk normal women. I was induced, and I used the Lamaze skills. I found them not very sustainable, and I called the teacher of the class afterwards, and she said to me, well, the skills don't work when you're induced. Well, I'm a human being. I thought to myself, oh, for F's sake, how can you have skills that do not work for all of us? 100% of pregnant women will give birth. We should have effective skills. That did not lead me to develop the Birthing Better skills with hundreds of families. That was sort of an accident. However, I've been really grateful, and I have committed 50 years of my life to continue to pass on the belief that within childbirth, 100% of pregnant women will give birth, and we should all be skilled to do this one-off activity. It's a one-off activity. Even with the families I've worked with who have 20 children, that's 20 times in your life to do something that is so life-transforming. We eat more than that. We have sex more than that. We do all sorts of life things more than that. So we have to treat giving birth as the activity it is. Now, as I said in the description, there used to be one birth. Everybody labored and had a vaginal birth. Unlike what the natural birth movement wants you to believe, that does not mean that everybody had a great birth, nor does it mean that women died in childbirth. Yes, they did, but that's not where the complexity lies. The complexity lies in the two factors. One is women who didn't have skills, who suffered, they didn't cope, and the other is women who have issues or risks, some of those turning into potential problems, and babies as well. And that doesn't just include pregnancy or the birth, it includes that period after the birth. In fact, 25 to 30% of all children worldwide, globally, died before the age of 5 until immunizations and antibiotics came along. So we now have 4 types of birth. We have non-laboring cesareans, we have labor and then an unplanned or emergency cesarean, we have a labor and a vaginal delivery in all sorts of forms and shapes and sizes, or we have a VBAC, which will be one of those 3. So I want to talk to each of you who are in that category, because Birthing Better Families were all of you, and we absolutely were committed to one is enjoying pregnancy by becoming skilled and working with our significant other so that we could grow and mature as human beings and feel more skilled in pregnancy, because pregnancy is a time where we tend to lose control. Once you're pregnant, you've lost control of your body. We know that. And in birth, there's no way to know what your birth's going to be like. So we lose control of that as well. So what can we control? And it's our behaviors. We can control how we cope and manage, how we deal with, how we handle, how we work through, how we stay on top, and how we feel in control. And this is particularly true the more challenging the circumstances. But it always feels good to be skilled. All of us are skilled. None of us lack skills. If you have children and you've taught them to put their pants on, that's a skill. Even learning to walk is a skill. Learning to talk is a skill. Humans thrive on being skilled. So giving birth is an activity. That's the word, activity. We have to do it. So Birthing Better Families developed skills to do that activity. And we developed skills to prepare our body to do that activity. So come along. If you're going to have a non-laboring cesarean, listen to that. You don't have to listen to the other ones. If you're going to labor and think you're going to have a vaginal birth and you might have an emergency or unplanned cesarean, listen to that. If you're going to have a vaginal birth, that's a complicated thing because that's where the division occurs, the natural versus medical, interventions or no, midwives versus obstetricians, home birth versus hospital. This is where it's crazy. And it's so crazy that as human beings, women as human beings, we have divided ourselves. And we've divided ourselves both unnecessarily and in very mean-spirited ways. And we do it even within our own family. When we look at our children and go, "Ah, she was a hospital birth. He was my cesarean. Oh, she was my home birth." Do you know what? Your kids don't care, and you shouldn't care. This is your baby's birth. And the gift that you give yourself, the gift that your partner gives themselves to you and yourselves and your baby, is that if you are skilled at birthing your child, just as if you are skilled to raising your child, because when you're pregnant, your child is here. Birth, your child is here. You need skills to birth your baby. So come along and let this old lady rant.